You will hear a practice IELTS listening test. The test is divided into 4 sections. You will hear each section only once. At the beginning of each section, you will have some time to read the questions. Listen carefully and answer the questions as you listen. Write your answers in the space provided. At the end of the test, you will have time to check your answers. Now, turn to Section 1.
Good morning, Green Valley Diagnostic Center. How may I help you?
Good morning. I'd like to book a full health checkup.
Certainly. May I have your full name, please?
Yes, it's Anjali Men.
Could you spell your first name?
Anjali.
Date of birth, please.
It's the 14th of August, 1989.
What type of checkup are you looking for? We offer basic, advanced, and cardiac packages.
I think the advanced package would be suitable.
That costs 6,500 rupees and includes blood tests, ECG, and ultrasound.
That sounds fine.
When would you like the appointment?
Next Wednesday morning, if possible.
We have a slot at 9:30 a.m.
Perfect.
Lastly, may I have contact number?
It's 987-6543-210.
Section 2. You will hear a talk on a social topic. First, you have 20 seconds to look at questions 11 to 20. Now listen carefully and answer questions 11 to 20.
Good afternoon, everyone, and thank you for attending today's public health seminar. We will be focusing on lifestyle-related diseases, which have increased significantly over the last decade. Conditions such as diabetes, hypertension, and heart disease are no longer limited to older adults. In fact, recent studies show that nearly 30% of patients are under the age of 40. The main contributing factors include poor diet, lack of physical activity, chronic stress, and insufficient sleep. To reduce these risks, experts recommend at least 150 minutes of moderate exercise per week, a balanced diet rich in fruits and vegetables, and regular health screenings. Free screening camps will be organized every first Saturday of the month at community health centers.
Section 3. You will hear a discussion between students and a tutor. First, you have 20 seconds to look at questions 21 to 30.
Today, let's discuss your group research project on vaccine hesitancy. Mira, could you start by summarizing your main findings?
Certainly, Professor. Our research indicates that misinformation, particularly on social media platforms, is one of the strongest contributors to vaccine hesitancy. Many participants reported encountering misleading posts that exaggerated side effects or questioned vaccine safety.
That's interesting. Did the source of misinformation seem to matter?
Yes, very much so. We found that misinformation shared by non-medical influencers had a greater impact than official government announcements. Participants tended to trust individuals they followed regularly, even if those individuals lacked medical qualifications.
So trust appears to be a central issue here. How did trust in healthcare systems influence decisions?
Communities with lower trust in healthcare institutions showed significantly higher refusal rates. This distrust was often linked to past negative experiences, such as poor communication or lack of access to healthcare services.
Did education level play any role?
It did, but not in a straightforward way. While higher education levels were generally associated with increased vaccine acceptance, some highly educated participants were also skeptical. They tended to question official data and seek alternative explanations.
What cultural or social factors influenced vaccine hesitancy? And did access to accurate information help?
Cultural beliefs were strong in rural areas, where community leaders often influenced decisions more than healthcare workers. However, people who spoke directly with healthcare professionals were more likely to accept vaccination.
Peer pressure also affected decisions. If vaccine refusal was common in a social group, individuals tended to follow. We recommend transparent communication from health authorities and limiting misinformation on social media.
Good. Make sure your report highlights public trust, effective communication, and education for future vaccination campaigns.
Section 4. You will hear a lecture on an academic subject. First, you have 30 seconds to look at questions 31 to 40. Now listen carefully and answer questions 31 to 40.
Preventive healthcare focuses on reducing the overall burden of disease before symptoms appear, rather than treating illnesses after they have already developed. This approach plays a crucial role in improving population health and reducing pressure on healthcare systems. There are three main levels of prevention. Primary prevention aims to stop disease before it occurs. This includes vaccination programs, health education, and lifestyle interventions, such as promoting regular physical activity, balanced diets, and smoking cessation. These strategies are especially effective in preventing infectious diseases and lifestyle-related conditions. Secondary prevention focuses on the early detection of disease. Screening programs, such as blood pressure checks, cancer screenings, and diabetes testing, help identify conditions at an early stage when treatment is more effective and less costly. Early diagnosis also reduces the risk of long-term complications. Tertiary prevention is concerned with managing established diseases. Its goal is to reduce complications, slow disease progression, and improve quality of life. Examples include rehabilitation programs, long-term medication management, and patient support services for chronic illnesses. Research shows that governments investing in preventive healthcare experience lower long-term healthcare costs. More importantly, these investments lead to improved population health outcomes, increased life expectancy, and a better quality of life for individuals. As a result, preventive healthcare is increasingly recognized as a key component of sustainable healthcare systems worldwide.